So this is part 2, and it's not going to be me in the episode. Dr. Maya will practically break down the steps of the integrative therapy, what you need to expect, and so it would be clear for you what exactly is. So Dr. Maya, please.
Thank you, Dr. Ina. So here's what we do. Obviously, the first time we meet, I take about like 20 minutes, maybe sometimes less, getting a sense of your life story, right? Like who you are, what you do, the important people in your life, what kind of work or hobbies you have. Then we move to knowing why do you think you came, what is it that is bothering you, whether you have a diagnosis like depression, PTSD, or anxiety, or you just feel like you're not, you're stuck in life, or you just don't feel good. After that, we move into grounding. So I like to work on the theory, with the theory of the polyvagal theory of activating the vagus nerve and calming down the sympathetic to encourage the parasympathetic more. And so we do movements, breathing, and certain movements, and even humming, first to calm the person in the clinic, but also to teach the person how they can handle their own state of being outside. So what you learn in the session, you take with you home. You'll never lose that. After that, usually we move into what is going on, what is bothering you at this moment. And there are certain kind of techniques, so depending on the person and your inclination, some people are more in touch with their emotions, some people are less closed. So different techniques, I can use something called emotional freedom technique, past regression, something called matrix re-imprinting, which is past regression, working with memories and altering these memories, so that because the subconscious doesn't know time. For the subconscious, what happened when you were 5 is ongoing right now. So when we go to that memory and console the 5-year-old aspect of you from whatever it was going through, the subconscious takes it as something that is happening right now. So you can call it memory repair. And then from that usually takes the longest time. Once that is resolved, we move into checking in with the body, where the tension is held, what kind of movement needs to happen. And somebody like Dr. Peter Levine made amazing work with that. And that really, I feel like, is a missing piece in a lot of integrative work and therapeutic work that overlook the importance of the body. Following that, I would give a handout where I will give a breakdown of the road ahead, how many sessions I recommend, and what would be, let's say I recommend 12, you will get an idea, what are we doing in the first 3 sessions, what are we doing roughly, right? Not specifics, but roughly, what are we focusing on the middle 6, what are we doing in the last 3, and so forth, and if and along the way, we can obviously adjust. It's not a rigid process. Sometimes we'll be like, well, you know what, you got better sooner than the 12. Then we stop where we feel like it's done, or some people feel like they need more. I think it's also an important thing to do, since we also offer ketamine IV. So ketamine is an option. It's not part of it, but it nicely combines with it. Some people are good candidate for the ketamine IV, especially people who have real trouble accessing their subconscious. People who are scared or have no familiarity with meditation, or completely not in touch with their bodies. Some people, we need that extra help. We need that magical door that will open, opening into the psyche. And then we continue with the integrative therapy. So it's not a one pill fits everyone. Everyone is different. That's why we need to sit with the person, talk to it, whether in person or online. Obviously, ketamine cannot be online, but that's not a necessity. As I said, it's an option for those who say, well, I don't feel comfortable talking. I've never been able to have ability be in touch with my emotions. That's not an issue. We have other methods to help with that. So I think it's really worth your while. I think our mental and emotional state affect not only how we live life, but how our health state is. A lot of illnesses happen because of years and years of neglecting what our body and psyche has been telling us, and then it crystallizes into a physical illness.
And what I would like to add, that if someone is experiencing any type of anxieties, worries, nightmares, stressful moments, there is always a reason why. Okay? And sometimes we think, oh, just because of that or this. No. So the whole point of that therapy is to find the core, the problem, the reason.
Yeah.
And if we find that reason, maybe it will require just one session to let that anxiety go. So it's not about dragging you for half of your life, like, you know, some therapists do,
Yeah,
because
years and years.
they're not looking for the core. They're just looking to subside the symptoms,
True.
to teach the person how to live with this anxiety.
Yeah.
But the true seed is laying where the core issue is. And like if we find that core, your whole life changes just because you stop attracting the same patterns over and over again.
True.
So if there is a question, why is it happening to me? Why I cannot find relationship, or why I cannot deal with, I don't know, certain situations, the pattern will keep repeating itself until you find the core reason what to let go of you. And I believe that Dr. Maya is able to pinpoint the core issue and work it out, not just anxiety or depression.
Sure.
And that's the whole magic in it, because we're not working with anxiety. We're working with the core issue that created that anxiety.
That's true. It's a change of the being. You know, the whole being will change its orientation. And one of the other things is that I've seen people who become dependent on their therapists. They cannot function without them. They go years and years because they don't know what to do otherwise. Our work, we actually give tools. We go with you a certain time. After that, you have the tools to be able to live life, because life has challenges and we're trying to figure it out as we go along, and we need all the help we get. So something about agency, you know, something about knowing that I can handle life when it comes to me because I have the tools, I think is very important.
Yes. So I'll give you an example. Let's say we have a patient who is scared of bridges. So there are two ways of treating this patient. We can help her with the symptom of scaring the bridge and convince her that bridge is not scary and you shouldn't be scared, and then work with that. Or actually find the reason why is this person initially scared of bridges.
True. Yeah.
And deal with that. So if you are experiencing something that truly bothers you, but maybe you're even afraid to say it out loud because for some people it can be funny, then there is always a reason. And let's try to find it, the core issue, and kick it in the butt.
Yeah.
Okay?